we have many people on the line, so please mute yourself when you're not speaking. Right, thank you. Okay, so this workshop is hosted by MORU, or the Mahidol Oxford Tropical Medicine Research Unit, as well as the George Institute for Global Health in India, and the Coalition Data Sharing Working Group, which I will explain a little bit later. So my name is Pek Yong Chia from MORU, and I am co-hosting this workshop with a few of my colleagues here, and I would want to acknowledge Dr. Uman John from the George Institute. Okay, so next slide, please, Brian. So just a little bit about the COVID-19 Coalition. If you haven't heard before, we set it up about in April, just after the COVID outbreak. And this workshop is co-hosted by the Data Sharing Working Group, which I chair. Our objectives are to promote effective, ethical, and equitable data sharing, to synthesize existing policies, guidance, and good practice on data sharing by funders, journals, and practitioners, to provide practical advice to researchers, as well as data management team on data sharing, including recommended language in consent forms for secondary use, recommendations for selecting repositories or platforms for data sharing, and other guidance on governance on data sharing. This workshop is funded by WHO. It's a funding awarded to a group of people who work on data sharing. And this workshop is part of the funds that we obtain. Okay, so without further ado, let's do some ice breaking, and I'll hand it over to Anne Osterrieder, who is sat in Oxford. Anne, over to you.
Hello, good morning, everyone. Well, good morning for those people who joined in the UK and other time zones. Good afternoon to Bangkok people. So we're going to start with a quick icebreaker for which we're going to use the software Padlet. And what we're going to do is I'm going to copy the link into the chat, and I'll share my screen and I'll show you how to use it. So let me share my screen. So we would like you to tell us how your day has been so far in one word. And in order to add a post-it note, you can either click the plus symbol, which should be in the right bottom of your screen, or if you're accessing it on the phone, it should be there as well. Or you can just double click. Now, when you double click, you get something like a little sticky note, and you can put your word of the day into the title. And if you want, you can also put your name, your organization, and where you're dialing in from today into the body title. And we'll give you a couple of minutes, and then we'll have a quick look who's here today with us. Oh, lots of responses already. Somebody says swamped by data. I don't know if that's a good or a bad thing. Maybe a bit of both. Looking bright, busy, long, hectic, fun, warm. Okay, that's certainly not warm in the UK. How many people do we have in total in the workshop? Okay, so for those who joined just now, we're doing an icebreaker. If you could please visit the URL that I just pasted into the chat and add one word that describes your day so far. And if you like, you can also add your name and where you're dialing in from.
Nice to see people from all over the world.
Fueled by coffee, yeah, Jessica, same here. satisfying, excited, productive. But it looks like overall people have had quite a good or productive day, which is good to see. Shall we, Pae-kyung, we can leave it up and then people can have another look a bit later in the break if they want to see where people are from.
So just one question for everyone. Does anybody have problems with the Padlet software? Because we're going to use it later for a more serious workshop. So if you have any issues, please let us know. Okay. Well, try it out so that we will know if you'll know if you know how you can use it.
I also added a big thumbs up. That's quite advanced use of the Padlet. Well done. So you can do that as well.
I've not used it before. Okay, excellent. We got a few people from Bangkok. We got a few people from India. A few people from South America. Not South America, South Africa. Okay, shall we move on then, Anne?
Yes.
Okay, so thank you for that. Let's move straight on to session 1. Session 1 is the introduction session. We have two keynote speakers, Susan Bull and Anand Ban. So I'm going to start with, so Susie Bull is going to start. And, oh, sorry, Brian, I forgot one. Did I forget one slide? Brian?
Yes, yes, sure. On the aims and objectives of the workshop.
Again, Susie, I forgot the aims of the workshop. Sorry about that. Brian, can I have the slide, please? So I'll make it start. So the aim of today's workshop is we have very, very specific objectives. Some of us in this group are developing an online electronic version of a data sharing course. And it will be free for use, and it will be targeted towards LMIC researchers, low and middle income country researchers. So the workshop today is to understand the training needs of LMIC researchers, particularly early career researchers, on how to effectively share data and also use data and reuse data collected by other people. So this is in particular COVID data, but not specific to COVID data. The other aim is so that we can scope out elements of the online training resource for data sharing for LMIC researchers. The course now is in development. So we are at the, I suppose 3/4 way through, and this is to make sure that we capture additional information that is particularly related to COVID and particularly related to this crazy times that we are in now. Okay, so again, thank you very much, because your input will be really valuable for the development of the course. And we will keep you updated on the development and where to find it when it's online and will be made free to everyone. Okay, Brian, thank you very much for that. And I will move on to Susie. So Susie is going to talk about the ethics and data sharing. So Susie Bull is a university research lecturer at Oxford University, based at the Ethos Center. Susie, over to you. You might want to introduce yourself a bit more. Go ahead. And thank you very much for agreeing to do this. Remember to unmute yourself.
Thank you, Pae-kyung. That's what I was just exactly trying to work out, how to unmute myself. So thank you, everybody. It's a pleasure to be here. I'm sorry, I can only attend the first hour of this workshop. So if there are any questions, please post them in the chat or the Padlet, and I will get back to you as soon as I can if I'm not still online. I know this workshop is how to effectively use and access and share data, but in this introduction to or overview of some of the ethical issues associated with data sharing, I've been asked to sort of go back to the beginning and look at some of the conceptual discussions and debates about sharing research data in the context of global health, and particularly more recently in a pandemic, because data sharing is, as we know, a relatively new phenomenon in research. It's been developing over the past 20 years, and it's now increasingly becoming a mandate and an accepted practice. But when it was first introduced, there were a number of discussions and questions about, for example, why should we share data, and in which situations should we share data and shouldn't we share data, and how should we share data? What is an appropriate way of sharing data? And it's useful to just briefly reflect on these, because we can see some of these issues discussed at these early stages are still underpinning our considerations of how we should or should not share data in an emergency. And in particular, some of the competing interests of the differing stakeholders amongst the researchers, the national health authorities, international journals, national journals, the researchers around the world who are generating data, and those researchers who wish to access the data and analyze it. And so over the past 15 years, a number of discussions have taken place about why we should share individual level data rather than, for example, aggregated data. And these are often that it really improves science, the ability to conduct a meta-analysis right down at the individual level data. We can ask questions in ways that we couldn't if we were just sharing an aggregate data set or research findings. And we can use this increased power to work with this data to address biases and deficiencies and dishonesty. And we've seen, for example, calls for data sharing in the context of COVID-19 in response to the papers on hydrochloroquine in the Lancet and the New England Journal of Medicine, and the calls for data to be shared, which then resulted in these papers being retracted when the data sets couldn't be provided. And we can also use data sharing to inform our future design of research, and it has been used to inform funding policies and approaches to funding research. And we're not just seeking to improve science for science's sake. You know, there's this recognition that we want to improve science so that we can improve health, address burdens of disease, that data sharing can inform the ways we design healthcare policies and allocate healthcare research. Allocate healthcare resources. It can inform regulatory review and ethical review of research, and it even comes down to that micro level of a clinician-patient interaction. It can inform how we treat a patient's illness. And there are discussions about the explicit moral basis for why we might want to share data. This, at the time, 15 years ago, a relatively novel approach. And this is very much this concept that we need to maximize the utility of the data. Research is expensive, as we know, collecting and curating data is expensive. And so that we can make the greatest use of the resources spent on the research, and that we're respecting participants by making the greatest use of the data. They adopted the burdens of research, they gave their time and energy, and in some cases adopted risks, and we collected the data from that, and so to respect them, we should make the maximum use of that data. And there's broader discussions about sharing data being in the greater or the public good, that it enables us to address burdens globally. And in balance with that, some of the concerns, the ethical concerns about sharing individual level data from clinical research and public health research are that the secondary uses of data may not be what we want. They may be flawed in some way, or they may be conducted to advance a particular agenda. And so there may be problems with those analyses, and they don't actually advance science, they hamper science. And part of the way that they do that, and that part of the way that might have implications for healthcare, is that it then takes energy away from primary research and primary analyses towards this kind of second-guessing reviews of new products going through regulatory systems or policies that may have been based on the initial analysis of this data. So there's caution that not all secondary analyses are good, and in fact they can be problematic, and what we need to have in place to make sure that we make good use of the data once it has been shared. And in terms of some of the explicit ethical issues, we see, of course, always front and center this concern that those providing the data are not disadvantaged or harmed in any way by it being shared. And as a minimum, we protect their privacy and confidentiality. And again, in the context of COVID, we have seen the extensive harms that have taken place when data has been shared without protecting confidentiality or privacy of participants, and people with COVID have been named in communities and the implications of doing so. My apologies, my phone is going mad. And there are also been a lot of discussion about evolving appropriate models for consent. As data began being shared, this idea that we would ask participants to consent to unknown future uses of data by unknown people was very important in exploring how could the consent be meaningful if we couldn't provide much information about what would be done with the data. And as we all know, curating data and sharing data is time and resource intensive, and questions about whether or not in constrained circumstances or any research contexts, that's the best use of limited resources is to devote them to curating and sharing data rather than, for example, conducting primary research. And then coming back to these questions about how we look, who has what interests in sharing data, the differences of views between, for example, major funders, global health organizations, national authorities, journals, and as I said, the researchers who are both generating the data and seeking to analyze the data, as well as patients and publics and communities. And we don't have time in this short period to unpack those, but Anant in the next presentation is going to discuss those a bit further. And so that's just a note for the publication where these are discussed in more detail if that's of interest. And we're looking particularly at more recent discussions in the context of COVID and in context of pandemics more generally. In terms of the moral claims, we see a very, very strong focus on utility. It becomes the primary moral consideration in many discussions of data sharing in this context. And we're looking at utility here not in terms of advancing scientific goods in a generic sense, but very much in a translational sense, that we are sharing data in a way in the anticipation that that will allow us to minimize suffering, to address burdens of disease and maximize the public good by addressing their health needs, and that we do so in the shortest time frame possible. And one of the tensions that arise with this need to rapidly conduct research is that we've had corners cut and there have been some inappropriate research practices, and that sharing data will also ensure that we have rigor and accountability in a situation where we have unprecedented rates of publication, pre-publication and retraction of scientific papers. That we can lift the hood on this research that's being published and check its veracity. And we see secondary considerations about solidarity and our collective interests. And here we're looking at, for example, our shared vulnerability to COVID and the expectation that countries and institutions should share data freely, and the expectation that this should be reciprocated. There should be nobody holding on to or siloing their data and not sharing it because it is in the good, the public good, the global health priorities to share this data. And also that sharing data will help us identify what is happening in different contexts and undertake comparisons and evaluations so that we can identify ways in which COVID is exacerbating inequities and to address those and promote a stance where no one is left behind, that we promote global health justice which seeks to address the needs of all. And although we're focusing on individual level data in this workshop, these discussions are taking place more broadly, not just with clinical research data, but also clinical data, epidemiological data, really interesting discussions emerging about digital surveillance data, genomes, and so forth. The ethical concerns that are arising still that we protect participants appropriately, but also that we include data. When participants have health needs, this increasing recognition we need to collect data to identify what those are and ways in which we might address it and to share that data. Debates coming up about who are setting research priorities within the pandemic and what data is considered inherently more valuable than other data and how that might be focusing which kinds of data are collected and which is shared and how and why and what is happening behind those, what are the ethical values and considerations behind some of these decisions. Always questions about fairness, the fairness of the distribution of the benefits and the burdens of sharing data. We see these discussions more broadly, for example, with vaccine research in terms of vaccine allocation in the context of COVID, but also underlying those are the interests in sharing the benefits and burdens of the data generated during studies, for example, to inform vaccine development. And finally, we see some tensions between utility and promoting equity. If we're seeking to very rapidly share data, those with the greatest resources might be in the best position to analyze and publish those findings most quickly. And who does this leave behind in terms of data collectors? So we see very briefly, including that typically in global health policy, the data analyses that are most likely to have an international national impact are based on very high quality, standardized and very curated data sets, and they often involve international collaborations between local researchers and international institutions on platforms or in research. And so there's already this view about what forms of data are most valuable to be shared and to inform practice. And how does that have implications for how we share data during COVID? And these broader questions of epistemic justice. And this, I love this quote, it's just saying that this approach is assuming the existence of an objective knowledge don't recognize the need for this diversity of perspectives to inform all aspects of the research process, from the prioritization of questions, the financing, the analysis, and the interpretation of data. And so how do these multiplicity of perspectives inform not only how we share data, what data is collected, how we share it, but how we use it and what use is made of those findings? Thank you very much.
Thank you very much, Susie. That was excellent. We will not be doing a verbal question and answer session right now, but we will save it for a bit later. If you have questions, please put it in the chat function. So we'll move swiftly on to Anand. Anand is a bioethicist and based in Delhi, India, and he will talk about the ethical imperatives of data sharing from the LMIC perspective. Anand, over to you.
Thank you so much, Fei Kyung, and thank you also to the organizers for inviting me to speak in this workshop. Susie, I think, has very well laid out some of the broad concepts around data sharing and some of the ethical tensions which we have been discussing for the last 10-15 years. And I think since many of you are not maybe specifically ethics researchers, what I'll try to do is maybe link that to some broad overarching issues which are relevant from an LMIC perspective, which might be of interest to hopefully all of you. Just to check that all of you are able to see my slides.
Yes, thanks, Anand.
All right,
yep.
Okay. Okay, so this is data sharing as an issue, I think, has been reinforced now by many agencies, right from WHO all the way to country level and regional, district, sub-district level. And I think the point Susie was making around data being a social or a public good is, I think, now well understood by policymakers as well. But that having been said, from a concept to application, there are some gaps, and I think that's where it becomes important. One area where I think there's been a lot of concern around data is the issue of transparency. I think now that we know there are many vaccines in the fray, just today, UK has announced that it is licensing the Pfizer vaccine for widespread usage. But there have been in the past questions around data not being transparently available, data specifically around safety, efficacy, as well as participant level data for independent evaluation and analysis. And I think that is an important issue to remember, that the whole transparency part around data is also important for us to talk about. We also know that there has been a fair bit of mediocre science. Susie was alluding to this, that just because there is a pandemic, there is a rush to publish. There have been many studies which have been conducted, but the quality of evidence, the way these are structured, the kind of online surveys we would have all received links to, not necessarily, most of them not probably going through ethics review, or sometimes not even having even a short consent form in the beginning part, points to the fact that there is actually a lot of data being collected. But is it being collected correctly? How is it being collected? Is there consent? What is the rationale for all of this data which is being collected? If there is a plan for long-term usage, is that described well? And are we really talking about the risk element of data, especially to participants, to research teams, as well as to trust in the clinical and public health enterprise? Now, there have been many people who I think have been raising red flags around the issue of the way research has panned out, which includes the data question, but the fact that we should not have a separate set of standards. I mean, the requirement to do science well and with adequate safeguards as well as quality also applies during a pandemic. You can maybe hasten certain processes, but you cannot have exceptionalism which allows for poor quality science to happen. And so the analytical integrity and the design issues as well as the data issues remain paramount even during a pandemic. Also importantly, while there's a lot of data which has been collected, yet at the other end, you also have situations where there's not enough data, for example, available in many LMICs on local epidemiology, on local clinical features, lab evidence, radiological evidence. This might exist at the level of facilities, but is it being collated at a population level to better inform what is the kind of pandemic we are seeing locally and how to better respond to it? And I think that's the kind of data collection, collation, and sharing that we also want to see more of. Not just data which is drawn from, say, a Western country and then used to make inferences from a policy perspective. It's also true that sometimes simple data, data on the kind of beds which are available. If I have a family member who is acutely sick, needs to go into an intensive care facility, sometimes you just don't know where beds are available. You're running around in ambulances trying to access beds. And there are now also indications that, again, in these kind of scenarios, corruption might play a role, where you might need to know someone politically or know someone in the health facility to be able to get access to an ICU bed. And obviously, that's not the kind of open data sharing about availability of facility beds that we should see. So obviously, as you can see, there are various forms of data which are in the fray, anything from clinical trials data to other kinds of research which happens, observational studies, operational research, surveillance data which is collected, anecdotal observations from clinicians, case series, etc. But I think also of relevance and of importance during a pandemic is the public health and clinical information. What is the epidemiology locally, especially? What are the kind of cases that we are seeing? What is the kind of implications on other organ systems beyond the respiratory system that you're starting to see? What are the long-term, sequelae of COVID-19 infection? And what kind of collection of data is happening towards better understanding that. But also data on where is testing available, what kind of testing is available, what are the kind of hospital beds which are available in a particular city or a location, and this being transparently available to anyone who might need it so that they can direct their patients in a referral mode very quickly to a facility where care might be available. Now, I think the significance of data sharing is not lost to all of you. I think all of you know this, that it helps us in encouraging further discoveries. You can reanalyze data. It can help increase confidence in the findings. It can optimize the value of data once collected, because we also know that there is a lot of data which is often left unused. It can help promote integrity and trust, because if there are concerns about the original data and the way it was interpreted, if you share it and there is an independent analysis which reinforces your original findings, then people will start trusting those findings more. It's also vital for decision makers. So policymakers look out for data and make decisions often based on that. Now it's also a requirement. I think the International Committee for Medical Journal Editors has also announced it as an ethical obligation that data sharing should be done responsibly, because participants have put themselves at often extraordinary risk by participating in clinical studies, and it's unfair to not have that data available to the larger research community. More specifically, during COVID-19, this is also important to help us do more efficient discovery of effective treatments and vaccines. We know that, for example, the sharing of the full viral genome quite early from China helped develop diagnostic PCRs, which were used across the world. We also know that data sharing has certainly increased, but what is the kind of information which is being shared, and how much of that is being shared also needs further explication. And any delay could also potentially mean that modalities which are important for COVID-19, whether preventive, diagnostic, or therapeutic, their development could get delayed, and hence it's important. So what then are the general challenges? And some of these are agnostic of location. I mean, these apply to high-income countries as well as low and middle-income countries. But the fact that researchers are reluctant often to share data. They say that we put in a lot of effort, time, and money into generating this data. What kind of returns credit do we get if we share it with others and they use it for their own career enhancement, for publication, etc.? So this whole issue of feeling that you own the data set because you've collected that primary data often exists. There are also often sometimes ethical barriers. You need to anonymize data, de-identify data before you can share it. That data might have been collected through consent mechanisms which do not allow for sharing, or you did not mention that you might have to share that data. There might be risk of breaches. There might be risk of group harms of discrimination and stigmatization by virtue of someone else using that data set and making inferences which could be culturally or from the local context not acceptable inferences. There could be reconsent requirements, which by itself is a complex exercise if you don't have original consent documents which allow for sharing. And this could be obviously much more difficult during a pandemic to go back to participants and ask for their permission for sharing. There might sometimes be legal or regulatory barriers in countries. Many countries now allow only data to be shared in a very limited manner, and data has to be housed on a local server. It cannot be shared with partners abroad unless they've gone through an intense exercise of de-identification, and that can be again taking a lot of time. There might also be technical barriers in being able to format your data, make it amenable to sharing in a standard manner, and that obviously requires funding, which can take time. There are also issues around credit, and I think especially many low and middle income country researchers worry about this. There is a fear of data being stolen or robbed, especially because many foreign universities might, for example, have access to millions of dollars of grant money to be able to leverage data very quickly. And here you are struggling between multiple projects with limited amount of resources available. And while you might have done all of the hard work, someone else could just take that data set and very quickly turn it around into a paper. The issue that you might not get authorship credit for secondary analysis is something which worries and has been reported in literature as a concern. Another concern is one of privacy, where even if you pseudo-anonymize data, we know that now with the way technology exists, that hackers or indeed actually researchers with resources could only with very few data points be able to very quickly re-identify individuals. So how much of privacy can we actually promise our research participants is also something which is becoming more and more difficult. Also the risk of data breaches and cyber attacks. So what are the kind of challenges to data sharing? Obviously, there are systemic issues. It requires resources. It is time consuming. There is sometimes a lack of standardized formats and data collection systems. Expertise might not be available. There is sometimes poor digital literacy and data science skills. In general, you might not have a data science expert on your team. They are often expensive. They might be available, but are you able to hire them with the kind of limited grant money that you have? Is there local expertise in data curation and metadata? And often that is not the case. There are also power dynamics between collaborations. There are perceived disparities in decision making between those who are primary data producers as well as secondary data users. And especially if you have funders pushing that, that also can be part of the mix. Then maybe, what might be potential solutions? Clearly, I think this workshop is moving towards some of those, talking about data management plans, talking about data sharing right from the inception of the research, using principles like the FAIR principles, where it is easy to then process data by making it findable, accessible, interoperable, reusable, increasing communication and engagement between both public and private health sectors, ensuring that there are clear, detailed data sharing policies which are written up, which, if they make data sharing mandatory, also ensure that interests of local stakeholders are taken care of and are detailed enough to cover quality issues, metadata issues, consent, data access and governance processes, as well as funder requirements. There have been innovations which have been suggested by way of incentives such as credit taxonomy, data authorship, but again, these are more conceptual right now in terms of recommendations, have not yet become wide currency in global health, but maybe we need to also look at what are the other incentives which could help promote the idea of data sharing, whether anything from certificates of participation, tax exemptions, information and communication material, sponsored exchange visits, etc., being made available. We certainly need to invest more. So there is a need for creating infrastructure for data sharing. WHO has enabled this in recent times via COVID-19 Open, one of their platforms. Where data can be shared while maintaining the authorship, issues around consent innovations, around broad consent being allowed by ethics committees, research ethics committees playing a role in reviewing researchers as well as sponsors' plans for data sharing, journals requesting authors to share analytical data, patient advocacy organizations playing a role by considering data sharing plans as a criterion for funding grants and promoting studies to their constituents. The requirement for global harmonization so that it's easier to collect data, store it, and then share it, and ensuring that there is also trust at the center of all of these activities, and a strong requirement for community engagement, so that communities, researchers, and the wider public will accept data sharing through their belief that this is being done in a respectful manner and that no one is being exploited through that process. So I'll stop there with some references, but hopefully this will help spark off some discussion along with Susie's overarching comments. Thank you so much for listening.
Thank you very much, Anand. That was really, really nice, highlighting some LMIC specific issues. We hope that you, Anand and Susie, can stay for a bit, but if you have to go, we completely understand. So thank you very much, Anand. Thank you very much again, Susie. Let's move swiftly on to Naomi. Naomi Waithira, she's the head of data management at the Mahidol Oxford Tropical Medicine Research Unit. And she will talk about data sharing requirements by journals, funders, regulatory authorities, with a specific focus on COVID. So Naomi, over to you.
Thank you, Pei-Kyung. I'm going to share my slides, and can you let me know if you can see them?
I can see them, yep.
Great. So my name is Naomi. I work for Mahidol Oxford Research Unit as head of data management, and I'm very passionate about data sharing. So my colleagues Susan and Anand have laid down the foundation very well about what are the ethical imperatives for data sharing, what are the challenges and the realities on the ground. So over the next few minutes, I'm going to summarize what the requirements are on us as researchers with regard to data sharing, and particularly in this time of COVID. So arising from the lack of coordination that was there during the Ebola outbreak, various bodies, researchers, funders, and publishers got together and tried to find a way in which the World Health Organization could have better access to emerging findings and therefore aid them in fighting the outbreak. And out of this, there was a statement on data sharing in public health emergencies, which was put up in 1st of February 2016. And basically this statement talks about how can we make the results generated from research quickly translatable into policy and into action which can be taken against the pandemic. And based on this statement, in 2020, when COVID-19 started, there was a new commitment written up by various bodies, and this is around sharing research data and findings relevant to COVID-19. There are several points in that commitment, and I pick out two specific ones which relate to data. And the first is that researchers should share interim and final research data relating to the outbreak, together with protocols and standards used to collect the data. And on top of that, they should do that as rapidly and as widely as possible, including public health and research communities and the World Health Organization. Now, in addition to that, as researchers, we're required to ensure that research findings are made available via preprint servers before journal publication, and that papers are made openly accessible before peer reviewing, but on top of that with clear statements regarding availability of underlying data. So you can see this is quite a shift from what would be the norm in data sharing, and I'll cover a bit about what the various requirements from different funders and publishers are with regard to data sharing in the general research environment. But here we are required to make the data available sooner, even before publication, and also to make that data openly available, of course, with relevant measures where there are ethical or legal concerns with the data. So as you can see, there are a few funders who have signed up to that. We've got quite a number of funders here who fund research in LMICs. And also there are research organizations and groups who are partisan to that. We've got Africa CDC, the Global Health Network, MRC in South Africa, and various others, including industry. And we've got also some journals, the New England Journal of Medicine, we've got PLOS, BMJ, Springer Niche, and many, many more that are not included in this presentation. But let's look at what data sharing looks like from the eyes of these different funders and how the requirements align or disalign with each other. So considering what the researchers want us to share, this picture here tries to summarize 5 funders who commonly fund research in LMICs, the Wellcome Trust, the NIH in the US, MRC in the UK, Bill and Melinda Gates and DFID. And if we consider the statements that they put up in their data sharing policy, we can see that Wellcome Trust and MRC require that data underpinning the research that they have funded needs to be made available, while NIH and Bill and Melinda Gates say data underlying the particular publication that you're making available is what you should share. DFID says that you need to provide raw or derived data set. So there's a little bit of difference between these statements. While they all relate to the same issue that you need to share the data, but what part of the data you're sharing is slightly different from each funder. Now, when do you share that data? So Wellcome Trust and NIH and Bill and Melinda Gates say that at the time of publication, you need to make that data available, while MRC is a bit looser in their statement, which they say is a timely manner, which I suppose is open to interpretation, while DFID state that it's within 12 months of completion of data collection. Now, just to mention, this is not COVID research, this is general data sharing statements by their funders. For COVID research, we need to do that we need to share the interim results, and also we need to share the final data as soon as available. Where do we share the data? Wellcome Trust says that we need to do it in recognized community repositories. DFID suggests open access discipline or institutional repositories. Bill and Melinda Gates say open community recognized repository, while the MRC doesn't quite specify. Now we talk about a little bit of data management plans. For those who may not be fully familiar with them, this would be plans that you write about what data you'll collect, how you will curate it, how you will share it. Now, some funders do require that you write a DMP at the onset while you're applying for the grant, while others may have slightly different requirements. So if we look at each of them here, the Wellcome Trust says that they do require a DMP, which they call an output management plan, if the output of your research, which could be data, could be software, could be mathematical models, if that output is considered to be of value as a resource to others, then they would like you to provide a DMP. MRC, NIH, and DFID require a DMP, while Bill and Melinda Gates don't explicitly require a DMP. So now looking just at those few examples there, you can see there's some subtle differences and sometimes even quite significant differences between each of the funders. Now let's switch a bit to journals. What do they say? So the International Committee of Medical Journal Auditors have a statement that clinical trials that began enrolling on or after 1st of January 2019 need to include a data sharing statement, and this must indicate if individual patient level data will be available, and if so, what part of it will be shared. What other documents will be available? The study protocol, study analysis plan, clinical study reports. When this data will be available, who can access this data, that is what kind of licensing will be applied or restrictions which will be there, and also how people can request access to that data. Now this applies to all of the journals under JME. If we look at the Lancet statement is that they encourage, note the word encourage, authors to share any additional data to the publication that you're providing, preferably translated into English, that would facilitate replication or further analysis of the work. For instance, the raw numbers underlying the analysis or the code for any modeling. Now you can see the statement there isn't very strict or prescriptive. It's an encouragement to share additional data. So it's not quite a requirement that you must share additional data. They do, however, recommend that the data is deposited in Mendeley data, which is a data repository, and they encourage inclusion of a data set, DOI, that's a digital object identifier, a means of identifying and tracking a data set throughout its life cycle, and also if anyone else is making use of it. And if you don't have a DOI, that you include a description of the means of which data can be accessed. For instance, if the data is held by an institution and you have to request a committee to evaluate your request before you get access to the data. PLOS is different. PLOS requires authors to make all data underlying the findings described in the manuscripts fully available without restriction at the time of publication. So that's quite prescriptive. It's quite clear what should be done. They, however, say that where there are legal ethical requirements, authors must indicate how researchers may obtain access to the data. And when providing the manuscript, the authors must, in addition, provide a data availability statement showing compliance with PLOS's policy. Now, PLOS is also quite specific that they will not consider submissions where conclusions relied solely on analysis of proprietary data. So there's a real and genuine push towards making data openly available and with appropriate controls over that. So if we consider also these three categories of publishers that we've just looked at, you can see there's quite a range of requirements from encouragement to requirement that the data needs to be shared. But one underlying thing is they all require that a data availability statement is provided, which says where your data is, which is actually a good step. So you may be wondering, how do I benefit from this talk? This is exactly the point, that there are a variety of requirements on us as researchers, and it's very important for us to be aware of what requirements exist on our studies, depending on who the funder is. So some of the best practices to make sure that at all times we can comply with the funder and funder requirements and also able to publish in the journals that we'd like to is first, prepare data management and the availability plan. This is not only useful to you as a researcher, but it also comes to be of use later when you want to publish your data. And then secondly, to obtain consent from participants for publication and secondary use of the data. If consent wasn't obtained, then that becomes a difficulty when you want to share data, particularly for clinical trials or data sets which could have data that's potentially person identifying. And then the other thing is to plan to de-identify or anonymize the data as soon as possible, and that also will reduce the amount of work needed when you're ready to share the data or when you do get requests for the data. And finally, be aware of funder requirements at the onset, as this may limit your choices in selecting journals or depositories, and also it will help with your compliance with the requirements which have been set out. So I'm going to pause there. Thank you very much for your attention. I know there may be lots of questions and comments, so we'll address those. Please put them in the chat box. And over to you, PY.
Thanks so much, Naomi. That was a wonderful summary of all the requirements out there. And if you're not aware of them, go and look them up now. All right. Thanks again. So then we're going to move swiftly on to the next session, which is a session on getting your feedback on the various requirements for each step of the data cycle. Brian, could you please pull up the slide? Yeah. So just to remind everyone, and especially those who join a bit late, that we are developing an online data sharing course that will be free for everyone to use. And this session or this workshop is about a needs assessment, especially for LMIC researchers, so that we can refine the modules. There will be about 8 modules, and hopefully it will be available early next year. It will be more or less targeted to early career researchers and for those who are looking for to have information about data sharing. It's not meant to turn you into a super data manager, but it's meant for people who are working in research in general. Okay, so welcome to the next session. The next session we're talking about the data journey, and we are going to get ready for some interactive activities. But first, let me I'll give you one example which everybody knows. There's an easy one. So as you know, WHO has a big trial called Solidarity. It's a COVID trial. So Solidarity is an international clinical trial to help find effective treatments for COVID. There are 3 important outcomes in COVID patients, for example, mortality, need for assisted ventilation, and duration of hospital stay. That's stated in their website, which I've taken from. So the Solidarity trial compares these treatment options against standard of care. So this example is just to illustrate what type of information that might be collected. But what in this study, you can imagine what they would collect, right? According to the outcome, so whether patients live or die, then whether they need a ventilation, yes or no, duration of hospital stay, number of days. So for that, you might collect things like outcomes, date of admission, discharge, adverse events, and concomitant medication. Now, what I would like you to do, everyone, is to take just 1 or 2 minutes to think about other types of data that you collect or work on in your work. Now, please, you can use the chat function. For example, you know, we might collect temperature. So type down. We just want to have, because we have quite a few people on the call, and it is not obvious the type of data that people collect. So please take 1 or 2 minutes to type it in the chat. And Brian, maybe you can start by writing the first one, and Naomi as well. Naomi, when you're ready, you can start. When you think you would like to start, go ahead.
Sure. Next slide, please, Brian. Thank you. So I can see a nice mix of different kinds of data that could be collected, from drug administration, medical history, compliance, demographics, injury severity scores, feedback from stakeholders to review study management plans. So that's quite a good range of types of data. So in this session, we want to crystallize for you to be able to collect the data that you need, for you to be able to share the data that you have, for you to be able to reuse the data that exists. What kind of resources would you need? What kind of skills do you need to have? And how can these skills be incorporated into a course is the objective ultimately of this workshop. So just to jog our minds and remind ourselves what each of these points entails, so data collection, sharing and reuse. Under data collection, let's think about where you would be getting your data from. That would be either primary data, as in you're collecting it for the first time, or secondary data that you're consolidating data which already exists. And for this, you would need tools to help you capture that data. You need some means of storing that data, so databases, some hardware. You might use computers, you might use mobile devices, maybe you need internet, maybe you need servers. And then you'd need to curate that data. So make sure the data is of good quality, pick out any errors and find ways to correct those errors if at all possible. Standardize the data and put it in a form that can be understood by other people who aren't involved in collecting it. So with data collection, just think of these main things and what kind of deficiencies you think there are and how this can be put into a course. Right, now next slide, please, Brian. And the data sharing, consider what you would be sharing. Would it be raw data? Is it basic information that you collected as is and processed, or would it have some processing on it? For instance, if you're collecting GIS information, you probably wouldn't want to share geocoordinates of where people live. You'd want to have that data processed to some level of aggregation before sharing it. Or perhaps you actually do need to share the geocoordinates, because then the people using it need to know the exact coordinates that you collected. Where would you share the data? Do you know where to put up your data set, or do you need help finding appropriate repositories? When would you share your data? Is that clear to you? Do you know whether you should do it during the study? Is it before publication? Is it after publication? And then how do you share your data? Is it by putting it on a USB thumb drive and giving it to your friend? Is it by sending it by email? Is it putting it up on a repository? And if a repository, which one? And then with whom to share the data? So thinking around licensing, there are very different licenses that can be applied on the data, which allows reuse and attribution of different levels. And also governance. Do you need a certain body to decide what aspects of your data are available to what parties? Some other considerations are ethical issues around data sharing clear to you? Are the legal issues around data sharing clear to you? For instance, if you work with pharmaceutical companies, there may be issues around intellectual property and who owns the data, and because that data could potentially be used to generate income, what kind of boundaries need to be put? Next slide, please, Brian. So on data access and reuse, think about, do you know where you can find the data that you need? If you find the data, do you have access to the data that you need? And after you've accessed the data, do you think that information can be reused, read by machines or algorithms where necessary? For instance, if doing big data or machine learning, you need the data to be read and automatically processed by machines without human intervention. Is the data already in those formats? Do you need help making your data interoperable? Do you need help making data that you find outside existing interoperable so that your machines and models can use them? And then the last bit is about reusability. If you know where to find the data and you can access it and you can use it, do you know how to determine whether the licensing applied on the data allows you to reuse for the purposes for which you have? Are you clear on what limitations there are on what you can or cannot do with the data? This is scientific etiquette, and part of it is also what legally is acceptable or not. So with this in mind, I'm going to hand over to Anne, who's going to take us through the next exercise, which will be interactive and will be using Padlet. Should be interesting. Anne, over to you.
Hello, everyone. Okay, so we would like to know, after Naomi's talk, what are the areas of support that you would need for the following three topics? So data collection, data sharing, and data reuse and access. And I'm going to copy the Padlet link into the chat. If anybody has problems writing posts on Padlet, or if anybody has additional questions, you can use the chat function as well. But otherwise, I'm going to share my screen and going to show you how it looks like. So we've got the three different areas in three columns. So what are the areas of support needed? And areas of support could be anything from training sessions or training courses, maybe templates, maybe SOPs, or any other resources that we haven't thought of or that aren't listed here. And if you could please just write anything that comes to your mind into the relevant column. And the way you post a note into the column is you click on the plus sign and it's going to automatically be arranged in there. And we're going to give you 5 minutes to do that, so you can have a chance to post something into each column and also see what other people are writing, because you might read something that sparks another thought that you hadn't thought of. Okay, so 5 minutes, I'll give you a warning a couple of minutes before. And I'm going to leave the screen open as well. But if you want to see the updated Padlet, you can click refresh on your website and then you see what other people have posted.
Also, if you can be as specific as possible. If it's training, what kind of training? What specific topics? If there are tools, what kind of tools? Is it documents? Is it templates? What kind of SOP? Perhaps how to clean data?
Okay, a couple of more minutes, and what we'll do is we'll then start talking through each column and summarize the answers and talk about interesting ones, but you still can keep adding posts to the columns. So if you leave the Padlet window open during the discussion, you can add things if you can think of them.
Somebody put in MTA. Can I ask you to clarify what you mean by that? Feel free to turn your camera and mic on. MTA, who put in MTA?
Hello, good morning, everyone.
Hi, hello.
My name is Landry Beara from Cameroon.
Yes, nice to meet you. I'm good. I'm good. So yeah, can you please explain your?
I want to know what about the material transfer agreement during the data sharing.
Okay. Okay.
Especially in period of pandemic or epidemic, because it's not normal to share our data if you don't have MTA. Our ethical committee is not agree with this kind of thing.
Mm-hmm.
What is the what is the legislation about this?
The MTA?
Thank you.
So normally we normally have data access agreements as well. Unless we are collaborators, and if you are a collaborator, you would already have a collaboration agreement in the beginning of the project. You will have a collaboration agreement. If you don't have a collaboration agreement, we would normally have a data access agreement, or you probably call it material transfer agreement. We call it data access agreement. And usually we don't share data without an agreement, because there is no way of knowing how or the other party might use the data, unless of course you're sharing with a group that maybe within your institution, so within another department. If we have that, we sometimes use a very, very small piece of document. It's just called terms of reference or terms and conditions. It's not a legal agreement because it's with another department within your university or organization. Naomi, do you want to add on that?
No, I think you covered it.
Oh, thank you. I'm very okay. I'm very okay. It's good. It's good. Thank you.
Thank you. Thank you for the question. Anand, I see you're still there. I don't know whether Susie is still there. Please feel free to jump in as well. Is there any more? Naomi, have you picked out any?
Shall we go through the 3 columns one by one? And
sure.
Okay.
Yes.
Okay. So I'll do a quick summary, and then Naomi can jump in and talk about some areas that interest you. Sorry, I can hear myself.
We can hear you too.
I can hear an echo. Is everybody muted? Okay, never mind. Okay, so data collection. There were quite a few post-its on informed consent, appropriate consent models, consent process to use social media data, GDPR, of course, a few ones on electronic health records and how to extract data from electronic health records. And then some posts around training. Naomi, did you want to pick up on some of the themes and ask the participants for more details?
Yes, I found this one quite interesting. One around consent, which says, what if participant says no to consent to sharing data? Should they recruit them into their study or not? And if they recruit them into their study and not share data, it's okay for their research. So I guess the question there is around consenting, and when participants do not agree for their data to be shared, while at the same time you do need their data for their research, what kind of guidance could be there? If we have Anand or Susie still on, perhaps you have some thoughts on that one. PY, I see your hand is up.
Oh, I didn't mean it. But if you like, I can say something about it. If Anand doesn't jump in.
Sure, go for it.
Okay. Well, it really, I think this is a very, very interesting question. Ideally, we would like everyone to agree to data sharing when they are recruited in studies, but it depends on what type of studies. I mean, if it's a pharmacokinetic study or with a small sample size, you're recruiting only 12 persons. If one person says, no, I don't want to join, then for my data to be shared, then I suppose you can, rather than having this person, you might want to have someone else join. However, if it's a life-threatening condition and joining the study is the only way to get the drugs, perhaps there are ethical problems about refusing someone. But, this is such a difficult question. I would like another ethicist to jump in if possible.
Is Susie still on?
Oh, I think maybe she's gone to bed. It's quite late in New Zealand.
Yes, yeah. Anand, would you like to jump in? Oh, I think he's missing. So yeah, I think that's quite a good question, because on one hand you have you do want to answer the research question. On the other hand, you also do want to share the data so that data could potentially be useful to the others, but at the same time respecting the wishes of the participant. And ultimately, if a participant does not agree to something within the study, it is really their call. And remember, research is all voluntary, not really based upon what we as researchers necessarily want, but also what the view of the participant is. So we can note that down as something to be included in the course. I think consent is a theme which keeps coming up. I see also there's a comment about the consent process for using social media data. There's another comment about what consent models should be used. So that's absolutely something we can cover. Somebody put in a comment about a data management team. Would you like to elaborate what specific needs there are with regard to data management team, or what you had in mind? You can unmute. Okay.
Hello, good day, everyone. So my name is Eric, and I'm from Ghana. So I asked that question to find out what are some of the required team members you'd recommend if you want to come up with a data management team. For example, if you work with a group of other health workers or probably other people, what kind of team would you require in order to manage your data better?
Okay, well, that's a good topic. We'll include that. So essentially, a data management team should be a group of people who will help you meet what you said in your data management plan. So you'd need somebody to help you, or if you're able to do it yourself as a researcher, create the tools for data collection. So create a questionnaire or a CRF, or if doing qualitative research, create interview guides. And then you need some way of storing that data. So some expertise with regard to selecting appropriate databases and creating those databases, or if not creating those databases, access to a database somewhere. And then you'd need to put data into that database for secure storage. So data entry people. Then you would need perhaps for maintaining a database, if you decide to build one from scratch, you'd need a programmer within the team or access to a programmer who can make the changes you want on the database as the study carries on. You'd need somebody to help curate the data, which could be yourself as a researcher or could be a data manager. And this person would be finding errors in the data and correcting them while the study is ongoing, and also standardizing data. For instance, if you're working in clinical trials, there are standards which are widely acceptable, like CDISC standards. So somebody with some understanding of those standards and who can be able to translate them into your study. And lastly, you need someone with some knowledge on how to archive the data. Some institutions have a records management group or archivist, others, the researchers themselves, do the archiving. So basically long-term preservation of that data. Does that answer your question? This all could be one person called a data manager, or could be different people with a different expertise.
Sure. Thank you so much for the response. I think it's very comprehensive.
May I jump in? So that's the data management specific role. However, when you are designing a study, it is advisable that you have a good clinical trials team as well, because they would help you to collect and monitor on site before the data even gets to you, to make sure that the data collection at the site, or let's say if it's done in the clinic or hospital, that their records are good, that it's verifiable. So and someone who is good with SOPs and quality control. So if your data comes from a machine, somebody needs to check that the machine has been QC'd, has been checked every so often. So yeah.
Okay. I think we should move on to the second column, but if you can think of any more questions, you can always type them into the chat. So I had a quick look at themes, and I think the three things that have popped up most in here are SOPs, de-identifying and anonymizing data, and also questions around digital platforms for sharing web apps and social media. And then there's some other interesting answers as well. So does anybody want to expand on their note? And if so, please raise a hand, or otherwise Naomi can pick up some of the responses as well.
While we wait for the hands to come up, I think the one I found interesting was SOPs. That kept coming up. What kind of SOPs would be useful? What kind of procedures do you find difficult to explain? There are lots of templates which exist. There are lots of SOPs written by different organizations, but which particular ones would you need? Any volunteers? Shall I pick a comment relating to that? There's one about they just read SOP. Detailed information on policies of data sharing. Come on, don't be shy. Okay, you can go in and modify, but it would be useful to know what kind of documents would be useful. On the identification, I think this is a huge one. We see this all the time. How do you appropriately de-identify data? Usually you'd be caught between, again, two ends. On one hand, the data needs to have scientific value. So even though you're de-identifying, it still should be used to answer a question and should answer the question reliably. For instance, when you think about going with the GIS data, again, if you aggregate the data to a very high level and you want to say map out a certain disease in a certain area, then it's no longer useful if the aggregation is perhaps to a district level. But if you get the actual geocoordinates, then you're able to more accurately do the maps. But then on the other hand, that might have an implication on the privacy of the participants, because if you're looking at a rare disease, even though the participants' names and details are not on there, but if you say you've got an amputee who lives in a certain village, there probably aren't too many amputees, so it's actually possible to identify who that person is. So the guidelines would be very useful, and I agree to have some guidelines around proper de-identification and anonymization. Also, what's the difference between anonymization and de-identification, and what level is the minimum required when sharing the data?
Okay, someone expanded on SOPs, saying detailed information on policies of data sharing. And PY just posted example SOP for getting broad consent.
Right, yes. Great ideas. So we'll include those. As from the first presentation I made, the guidance for data sharing varies quite a lot between different funders and between different publishers as well. So guidance around what is required would be useful. Again, to say that changes over time. So of course it's relevant as at the time that guidance is being provided.
So somebody posted ethics committee. Does that mean guidance on ethics applications, or maybe that person could specify a bit more what they meant with ethics committee? So what particular aspect of ethics committee? Or does anybody have something to share about their experience with ethics, with their ethics committee and data sharing? So if anybody would like to share examples from their practice, they're very welcome to do so as well.
So just to point out that you're asking about ethics committee, right? Not data access committees. So I see that as two different things. Some people assume they are one thing, but so the ethics committee that approves the original research, right? Is that what you mean? Okay, maybe we should move on.
Okay, so we're going to move on to the third column, but if anybody has any more thoughts, please put them on the Padlet or into the chat function. Okay, so data reuse and access. I couldn't really come up with themes other than training, because it seems that there are lots of different issues and areas that people think they would need support on. So maybe again, I can pass to Naomi and Pei-Kyung to say, did you pick up on anything that you thought was particularly interesting or relevant comment?
Yes, there's a comment there about working in data science. They come across reusable codes and models, but the data was not accessible, or sometimes they're not available in my region. And there are sometimes payment issues as well. Would you like to expound on that one? I think that's a very interesting point.
Okay, hello. Can you hear me?
Yes, I can hear you.
Yeah, I'm from Bangladesh, and I've been working with data science for quite a few months now. And like just last week, I came across a model that I had to use. It was something about a land cover model that was acquired by a sensor, Sentinel-2, that we use in remote sensing. And the data, the codes, everything was reusable, as we can now leverage online servers. But the data that they had used, the primary data, it was like land cover data for some region in United States. I tried to use the same model for my country in Bangladesh, but first of all, the data was not available. They used some kind of a land cover data that had been only collected for for the United States, but not for my country. And when I tried to use their data, that was basically not mentioned in the paper or the blog post. I'm sorry, I don't remember what it was, and they told me that I had to use some kind of a credit card or something to pay for the data afterwards. So it wasn't free. So I had no data from my country, and when it came to their data, it wasn't free or freely available. So yeah, there are issues like this quite sometimes.
Yeah, thank you. I mean, I think that's quite common. There's a general tendency that market research data is sold. So even in medical research, for some institutions, they would want commodity. So yeah, that's a very important point. Thanks for sharing, Maisha. Somebody posted that publishing electronic health records is a need. It's a useful theme. Would you like to expound on that? Publishing data from electronic health records, what kind of challenges are there, either with reusing access or with sharing of that data? What are your experiences?
Yes, just to contribute on the question of publishing data from electronic health records, one of it that I'll tend to imagine is this data is not structured in some way. And you'll find that based on how the data was collected, it wasn't made for research purpose, but generally for reporting purpose. So you find if you are to use that data to publish, then you have to go further step to curate the data. You might find in some way you don't get all the information that you need.
Right. And also comes to mind that electronic health records data is not necessarily collected for research. And so there may be issues with quality of the data. There may be issues with whether consent was provided for that data to be reused. Or even if you, as researchers, we can have access to that data. Sometimes for very rare conditions, that's the only source of data you have. And what kind of governance is there to make sure there's equitable access and also access when the data is needed. Okay, I can see there are some points about GCP and data processing, how to deal with missing values and process it further. I think those are two separate points. And then another one I see is training, study protocol, how to include proper procedures and etiquette training and conventions on data sharing. So these are all good points. We'll definitely take them on board and incorporate them into the course in some ways. We'll group them into themes and then build on the course that we're building. I think in the next session, Brian will discuss the different modules in the course, and we can see if some of these issues that have been raised here are addressed in those modules. So I'll pass the session back on to the chair, Baek-Kyung. Chair.
Thank you so much. So we can take a couple of minutes for questions if there are any before we take a small break. Feel free to open your mics and ask a question verbally. Otherwise, shall we take a 10-minute break then? Okay. It's 10 minutes, isn't it? So let's say we come back at 16:40 Bangkok time. What time will it be in India? Well, 10 minutes, and other places 10 minutes. Okay. Well,
it'll be 3:10 in India. So we are at 3 p.m. So 3:10.
Okay, Uman. See you all in a bit. Please do come back because the next session we're talking about training materials that are available. Okay. Thank you.
These tools are available to
Okay, it's now 4:40. Time for us to return from the break. I believe most people stayed on. I think there were some who left and will return. So the next session will be about finding what the current data management or sharing training materials or courses exist. And then we'll have an activity to give feedback on some modules which have been drafted already, which will express relevance also based on some of the needs which were stated in the earlier session. So we're going to start the next part with an activity led by Baek-kyung and Anne.
Okay. So the next section is to look at what are available training materials that are already out there. And again, this is to help us fulfill a niche that is not already there. So if you can help us with this bit, it will be very helpful. So the question is, which data sharing training courses or what training courses do you know of or have used? And if you can put it in the chat, if there are links, please put it down there. And if you know that they exist but haven't used them or have used them, please give some as a reason as well. So this is to gauge what type of courses or people would prefer. And you can use the chat function as well. Brian, I would like to just flash the next slide so that people can see what I mean. So I'll just give you one example here. This example I have here is on the Global Health Training Center. This is a course developed by Susan Wu, from whom you've heard from just now. It's called Ethics and Best Practices in Sharing Individual Level Health Research Data. This one is available online and for free. To access the Global Health Training Center, you need to register as a member and then you can just log in for free. So again, this is one example. Please, if you have other examples, we would like to know them because we are not necessarily know all the courses that are available out there. As far as I know, there are not so many. So please let us know. Can you go back to the preceding slide, the previous slide, Brian, and so the questions are there. So please put in the chat function what training courses are available that you know of. And if you have done internal courses, also please let us know. And don't worry if you can't remember the full title. Okay. You have a few minutes to do that.
Are we doing this as a Padlet exercise?
No, we're just using the chat function because we thought if people want to copy and paste links to websites, then this would be more useful.
Okay.
So just use the chat function, please. You can also like or give reactions to other people's comments if somebody already said something that you don't want to repeat.
Are there courses in Ghana or in Cameroon? Or Bangladesh?
Okay, if you haven't done any training or if you don't know of any training, it would be really useful if you could type that as well into the chat, because then we will know that there is probably a big need, but then we will also know that you can actually hear us in the workshop, which would be, which I'm starting to worry a bit about. So a good health research practices course, is that, I assume that's an overall course, and it probably was only a portion of it, and it was not one course dedicated to it, I assume. Yeah, yes. So if this was part of another course that you attended, like the Good Health Research Practices course, maybe you could give a bit more detail about how much time was spent on it. Like, was it 2 hours? Was it 3 sessions? Or was it half of the course? That would be of interest as well.
So thank you, Cherry. Thank you, Joseph and Prashanti and Uman, Brian, Sumaya. Okay. Now this is really useful because when we started this project, we were wondering whether there are things already, courses already out there. We have a feeling not, but we are just worrying whether there's already something comprehensive out there that we don't know about. And we'll be wasting our time.
Okay, we're going to give you a couple more minutes if you want to post about existing sources that you have. If you have already posted, it would be interesting as well if you could tell us how you found out about the courses, because that's is going to be relevant for us as well. How should we promote the course?
So I see that a few things in India. What about other countries?
Okay, interesting. Courses are available, but people don't know where to look for them. I think that's a really good point, and maybe if you don't know where to look for them, maybe you could also tell us where you normally look for training courses. So how do you find out about training in general? Is it like word of mouth that people tell you? Do you have mailing lists that you would expect this to be posted as an announcement, or are there any social media accounts that you use to find out?
Google is good. Uman? Excellent.
Okay, that's interesting. So courses aren't free in Bangladesh. I think so we're going to talk about barriers in a minute, and I think that's cost is of course a really important barrier. Social media and WhatsApp groups like the Young Researchers. So the Young Researchers Forum has popped up a couple of times. Does that just exist in Ghana, or does that exist in other countries as well? The Young Researchers Forum? Like, is it local to Ghana?
Thank you, Sumaya, for the links. So the Global Health Training Center, that's where we are planning to put our modules on. So good to know that quite a few people have used it.
Okay, shall we talk a little bit about barriers as well, Pek Yong?
Yes, sure. So thank you for all the suggestions and all the links. And so the question is, if you know of all these courses there and you haven't taken them, I assume not everybody has taken all the courses that you know about. Why haven't you? Maybe I'm going to call on Cherry. Cherry, why haven't you taken that course that you mentioned? Is it time? Is it because you don't like the format? What's the reason?
It's rather personal. I just didn't get the time to do it.
Okay. Thank you. I speak on you. I mean, we all this is important to, for us to design our platform and things. I like your Young Researchers Forum from Ghana. How old do you have to be below to join that forum? Joseph?
Hi. So the young in this sense is used figuratively just in order not to alienate people who are interested in research. So we do have very old people joining the Young Research Forum. We have a lot of the professors in the Young Researchers Forum, and it serves as a barrier breaker between the very young researcher and then the very advanced, and creates an opportunity for mentorship.
Thank you. That's very, very cunning, but very clever. Thank you for that.
So I wanted to pick up on the time element, because I think that's quite an interesting question as well. So of course, there are lots of questions about the topic, as we saw from the first Padlet, and I'm sure you could spend weeks and weeks on training, but how long would the course need to be in order that you think this is a realistic course to do and to fit in? So would you prefer something to only be a couple of hours so you can do it in an afternoon, or would you prefer something that is in more depth and might take a bit more commitment, like one of the Coursera courses that has sessions every week? Or would you do a mix? Or does anybody want to comment on that? Vivek? You're muted, Vivek. Oh, that's interesting. In depth but self-paced. That's a good comment. Lots of hands-on assignments, in depth on regular basis. I guess that's one of the problems with the Coursera courses. If they're totally self-paced, you might not do them because something more urgent comes in between. So I'm doing a Spanish course at the moment, and it has about 1 hour and 15 minutes of self-learning, but then there are regular live sessions every week for 30 minutes, which is just enough to make me panic the day before, thinking I haven't done the assignments. So are there any other course models that you thought were really good in the past that maybe are a mix of self-learning and tutor sessions, or do you prefer to learn totally independently, so in depth on regular basis? Okay, I'm thinking. So, does anybody want to say anything? So, assignment and self-paced videos. Okay. Courses with a mix of audio tutorials and text, hand-on sessions.
Very useful comments.
I have one comment which is quite interesting. Learning by doing is often a preferred method than reading something online. Are there specific tools or any aids that you need, or would you rather delve into something new and learn by discovering it yourself?
So Maya said competition can help. What kind of competition do you mean? Would you like to expand?
Oh, I was actually just trying to make it more interesting. But sometimes it really motivates when you know there are others also who are trying to understand a particular side of a domain and working towards getting better understanding and designing something themselves. So that kind of competition, as in, more of peer experiences where you can learn from each other's failures and successes and then build on it. And definitely, I believe hands-on training, or actually doing it and then learning it while it's happening is a preferred method for me. I've learned a lot more from observerships than from online readings alone. So that's something that's coming from my own experience. Thank you.
Yeah, okay. Video course 1 hour per session with regular schedule, maybe once a week. You need a lot of motivation to keep pace with self-learning. Yeah, that's really true, I think. That's interesting.
Definitely.
Learning assignments where experts would give feedback later. So sorry, somebody was saying something? Did somebody want to comment?
Yeah, I think there's a comment also around motivation when doing the online classes by Dr. Evaezi. You need a lot of motivation to keep pace with self-learning. So that's a very good point. I've seen in some courses that they actually block a week where everyone joins in from wherever they are. So even though it's an online course, you're all sort of in a virtual classroom and you can have chats and group work.
Okay, yes, and I guess time zones are a problem as well, as we can see with this workshop. So actually bringing people together in classes can be very difficult if there's a 13-hour time difference between UK and New Zealand, for example. So yeah. I'm thinking, shall we maybe move on to Brian's presentation of the draft modules, and then we can pick up some of the comments later and think about, if you would see this course, how would you want to take this course, and give us more comments on that. But if we hand over to Brian now, please.
Thank you, Van. Yeah, I'll make this presentation in 2 parts. First, I'll cover the first 4 modules. Then we'll have an activity. Then we'll proceed with module 5 to module 9. The first module is the introduction to data management, which is an introductory module to give early career researchers just an overview of what data management entails. Here we look at the overview of the data management process in biomedical research. Then we look at the data lifecycle from the point of data designing of your data collection tools, the data collection process, the data curation, storage, and archiving. Then we'll have a practical guide on how you can create some of the data management documents, one of them being the data management plan, and then the data management and also a data sharing plan. Then for module 2, it will be about the ethics, which is a very broad topic. And in this one, we'll be able to look at some of the few topics in regards to ethics that we consider to be important for early career researchers. One of them will be the benefits and the risk of data sharing. Then we look at the consenting process, because as you collect your data, you should be able to collect it in a manner that does not restrict you when it comes to sharing. You are not restricted to the consent that you received, that it doesn't restrict you from sharing the data. Then we look at issues of privacy and confidentiality. As you know, if you are sharing data, there has to be privacy and confidentiality so that you protect the study participants or the source of where you collected your data. Then we look at promoting of equity, equity in terms of the side of the researcher and also the participants who generated the data. Then module 3 will be about the data quality. We look at the data validations, the validation that you need to put in place so that you ensure at the end of the day, once you collect your data is correct and valid to answering your research question. And also it can be used by other researchers to do secondary analysis. Then we look at the role played by the monitors in ensuring the data is of the set standards and meet the required data quality. Then we look at the data quality reports that you generate as you do your research in order to measure if your data meets the required quality standards. Then we look at compliance to the regulations that are commonly used in biomedical research, one of them being the GCP guidelines, FDA, CFR Part 11, to ensure that whatever data you are collecting meets some of these regulations and it's of the required data quality. Then module 4 will be about data governance and policies. We look at the players, the data custodians, the data stewards, the trustees, and we look at the data ownership. Then we look at also the data governance management process. Based on the institution, do you do the managed access or is open access? So we'll be able to look at this and see what are the merits of each of the modules that you adopt. Then we look at the composition and the formation of the data access committees, their membership and the mandate, and the role they play in data governance. Then again, we look at elements of institutional data sharing policies. In your institution, what are the elements that you need to look at in coming up with the data sharing policies? So that's the end of the part 1. So I hand you over to Anne for the first activity on the Padlet.
Okay, thank you, Brian. So the way I think we'll do this is we're going to start again at the module 1 slide. And so after Brian has given you the overview, we're going to go through the modules one by one. And we would like to know, Brian, would you mind sharing the slide for module 1, please?
Yes, please.
So we'll just give you a recap because we don't expect you to remember what was in module 1. Have a look at the slide for a minute. If you have any questions about any of the points, you can put them in the chat. And otherwise, we ask you to score each module on the Padlet on a scale from 1 to 5, how relevant this module is to your needs. So 1 meaning it's not relevant at all, and 5 means that it's highly relevant. So so we're not asking you to rank them. So if you think that all modules are highly relevant, you can give every module 5. But what we would like to know is if there's a module which you think that's not that needed or maybe lower on priority, then it would be useful to us to know which of the modules we should prioritize. So we're going to start with module 1. If everybody could please put on the Padlet on a scale from 1 to 5, how relevant is module 1? And don't worry about the others yet. If you can't remember what they were, we're going to go through them one by one. Okay, so 3, 5 so far, 4, 5. We should have about 20 participants, so we're going to wait a couple of minutes until we get the 20 or near to 20 comments, and then we can move on. Do you have the Padlet open, Brian? Can you see the responses?
Yes.
Okay, good. So about half of people replied. Let's just wait another minute. Okay, so that looks like it's highly relevant because most people give it a 4 or a 5. So that's really useful for us. Okay, let's move on to module 2. Ethical considerations, benefits, risk of sharing data. Well, I won't read it again. You can have a look at it.
I can see you have a number of responses, most of them, majority being 5, then 4.
Yeah, if you've got problems with the Padlet or if you prefer the chat function, you can also put it in the chat function, like Matthew just did. Okay, let's move on to module 3, since most people have replied. So module 3 is data quality. As you can see on the slide, the contents remind you.
Yes, we have a number of responses, most of them being 5.
Just waiting for a couple of more people. Okay, let's move on to module 4. That one seems to be a little bit lower.
Yes, majority of them are 3.
Few more 3s. Okay, now before we move on to the others, does anybody want to comment either on one of the modules, like if they feel very strongly that they're very useful, or if they feel very strongly that any content is missing from one of the modules, you could say that, or if you feel overall that these would be useful modules, any kind of feedback would be really appreciated, and you can post that in the chat as well.
Yes, there's none from Dr. Ivaz.
Yeah, hi, good morning, good afternoon, good evening. I just wanted to share my observation based on the presentation. My thinking is that, for most early careers, we have some basic understanding of data management. But I think in my thinking, data sharing is where it's a bit not very strong in my own experience. So module 1 is quite important as an introduction. And I was thinking that if we could swap modules 2 and 3, such that we can talk about data management and then data quality. And then when we go to data sharing, it continues with module 4, that looks at governance and all of that, which is where I think for most early careers, there is limited information or limited knowledge. And so if we could make this module 2 to module 3, it ties in very well with module 4, which also goes into sharing policy and all of that. We recently set up a data, creation, a data archiving system. And so, it was a bit of a learning curve for most of us in the center to go through, understanding the policies for data sharing, creating consent form that has a section to do with data sharing for participants to be aware. So I think that module 2 and module 4, are quite important from my own experience. Yeah, thank you.
Thank you, that's really useful. Does anybody else have thoughts on if module sequence should be changed or if modules should be combined? Or Brian, do you have any more thoughts on that?
Yes, I think the comment from Dr. Vaz is very, very important in the sense that being a researcher, you want kind of there's what you consider to be of key importance to you in terms of understanding, or now if you have to collect your data, if you have to understand the data management process, what you consider key to you, because you are not doing everything as the investigator. There are other teams that are helping you in that. So it will be important to get to understand what information is critical for the investigator or the researchers to understand. And again, also the needs vary because the needs of a researcher who is collecting the data and the needs of, like I can see that the comment needs of a data analyst, they are quite different. So it would be good to get that feedback so that we can be able to frame the modules in the proper way.
So Maisha said having one common and open data pool for one kind of data is important. The data pool can be curated by any responsible organization. Do you have any suggestions in which module this could be included, or would you like to expand on your reply? Or Brian, do you have any thoughts on this? Okay, shall we move on to the next modules then, Brian?
Okay, thank you for the feedback for the first 4 modules. Now we proceed to module 5, which will talk about data reuse principles. And key to note is in this we'll be looking at the FAIR principles, which enable your data to be findable, accessible, interpretable, and reusable by other researchers within the data ecosystem. Then also this is also how you make your data identifiable, like adding the ORCIDs, the DOIs for reference purposes, and also the license that you apply to your data. Because depending on the license that you apply to your data, you can have restrictions on how your data is used. So it will be good to understand some of the guidelines that you need to do in terms of your data licensing. Then module 6 will be looking about data repositories. We'll be looking at some of the key elements that you need to consider in selecting a repository. Then we look at the available data repositories, because there are categories of data repositories, some that are institution-based, others are disease-based. So we'll be able to look at what data repositories are available and what you need to consider in selecting a particular data repository. Then we look at some of the practical illustrations on how to deposit your data into a repository. In module 7, this will be an advancement on module 1, where we look at advanced concepts in data management. We look at the tools and technologies available for data curation and manipulation. We look at the different data storage solutions available, because as you know, they are, depending on your need, there are different solutions, either on premise, having the servers on premise, or in the cloud, or an hybrid, which is a mixture of both. Then we look at the advantages and disadvantages of each of the solutions, and maybe from that now you can do a need analysis and identify what solutions you need. Then we look at the backup and disaster recovery, what options are there for you to have a stable data backup, and in case of any disaster, you're able to recover your data. Then we look at how different systems in data management can be integrated to be able to communicate together. Then one very important topic is also the data security, so that wherever you put your data, you are sure that your data is secure. And module 8 will be about what you need to do before you submit your data to a repository. We look at a checklist of the things that you need to ensure that your data conforms to before you submit it to a repository. One of the things is you need to ensure that you have consent for you to share the data, and also your data is identified to protect the study participants or the people who provided you with the data. Then we look at the documentations, because once you are depositing your data to a repository or sharing your data with other researchers, you need to ensure that your data is well documented. There is enough metadata for others to be able to use your data. Then issue of the licenses. And then the question of where do you deposit your data? How do you select your repository? And module 9 will be about costing. As you all understand the research process, there is a cost involved into it. So this will be about looking at how you can do costing for different items, from the pre-planning of your study to data collection, curation and storage of your data. We look at what are the methods that are available that you can adopt to cost each of the items, because also you understand that when it comes to sharing of the data, data is not shared for profit making, but again there is cost that was made in collecting of the data and preparing of the data. So if there comes a time when you are required to provide the cost that you incurred, maybe for the person receiving the data to share part of the cost, then you need to provide the documentation. So this is what we'll be looking up at developing. And I hand over to you for the second part of the Padlet exercise.
Okay, thank you. So we've now got a second Padlet where we're doing the same scoring exercise. And Brian is going to put up the slides again, one by one. So module 5, data reuse principles. How relevant is that to your needs on a scale from 1 to 5, with 1 being not relevant and 5 being highly relevant? You're getting quite a lot of 4 and 5s here, which is good. Going to repost the link for Joseph, who just rejoined. So this is the Padlet link that we're currently using. And again, if anybody has any comments or questions on any of the modules, please feel free to put them in the chat and we'll pick them up after we finish the scoring. Just wait.
We have a number of responses for the data reuse principles.
Okay, shall we move on to module 6?
Oh, it's like everyone is giving module 6 a score of 5.
Okay, shall we move on to the next one, module 7?
Advanced concepts in data management.
That one's getting a few more 3s, and would it be of interest to you, Brian, to know why this is maybe not as relevant?
Yes, we can get a few comments from the participants. Maybe I see majority of them are giving module 7 a score of 3 and 4. So maybe someone can tell us why they think this module is not very much relevant to their situation.
I think Anne's question is slightly different, right? I think the answer is Brian is looking after this one. He can postpone it a little bit.
Well, I guess I wondered why people thought this wasn't as relevant, and I wondered if it was because they already know these things or because it's not part of their role and someone else is in charge of it. So So this information would be useful for us as well. Okay, Dr. Evaisi raised the hand. Yes, please.
Yeah, just wanted to maybe make a comment as well as a question as well. I think it depends too on the target audience for you know, the whole course, the whole model. If the target audience is maybe those early and middle in terms of data management, advanced concepts might be a bit of a drag to keep up with. So I'm thinking that if it's for those who are very much into data management, and you know, then it will be quite important. But if it's someone who does data management as part of his other activities, then you know, having some brushes might be fine, but maybe getting to advanced concept might be more of a challenge sometimes. That's my thinking.
Okay, thank you very much. Do you want to add anything, Brian, or shall we move on to the next one?
Yes, I agree with Dr. Evans, because if you are not directly involved in the data management, the advanced course will not be very much suitable for you. So yeah, so I agree with him. Thank you.
Okay, module 8 then.
This is about the preparation of data sets for sharing.
Okay, that's getting a lot of 4 and 5s as well. Gonna give it another half minute. Does anybody want to comment on module 8? And if not, we'll on module 8, and if not, we'll move on to module 9. Okay, 1 more minute to give you a score for number 9, and then we can pick up on the 2 comments that have been posted in the chat. Okay, great. Thank you, Brian and Naomi. Do you want to respond to the comments, or does anybody who posted a comment want to speak in more detail about it?
Yeah, there's a good point that Maisha raises. When making the data accessible, it's important to check the data format to be easily used. Are you referring to standardization of data, Maisha?
Yes, something like that. Like when we use data for like image data, sometimes the data is for image data, for satellite data, they are like sometimes in IMG format, which is basically a software-based format for only that will work in 1 or 2 softwares only. There are TIFF formats which are good for machine learning. Then there are simple JPEG or JPG or PNG formats. So it's good to standardize the format or what you said.
Right, that's excellent. Yes. And a good point as well, because I think currently in our course we talk mainly about quantitative numeral data, but considering also issues around imaging data would be useful. I think Cherry also raised the same issue that we need to consider a variety of data. Cherry, can you expound on what kinds of data you have in mind and what you work with?
Hi, I'm working mostly on numeric data, but I do have seen photos, images like X-rays, and also I guess what I'm thinking also about qualitative data like recordings and regulations and how exactly we can share those, and whether data dictionary is also needed for image data types. I think that will be quite different regarding for different data type. So if there's specific guidelines that we should follow based on that, I think that would also be quite helpful. And the other thing that I was thinking is whether it's also worth considering different study fields. So for me, I'm doing clinical studies, so that will be very much on numeric. But for someone who works in the labs, maybe a more relevant data type for them will be kind of genetic data or imaging or some other types. So yeah, I'm not sure how would you want to stratify, but I thought that would be quite a consideration that you might want to have.
Well, thank you very much. Those are very good points. We'll consider what additional kinds of requirements there are on various types of data that clinical researchers encounter, and we'll see how to include this in the course. So thank you to you both.
Yes, and just to expand on the question of data accessibility and reusability, again, you find depending on the format that you present your data in, some of the systems or software required to access the data might be very expensive for other researchers to afford. Yeah, so it's good to work to kind of standardize the data so that it's easily reusable by others.
Okay. These are all really, really interesting, really valuable comments. So thinking back to the discussion we had about the mode of training and time investment and what course, does anybody want to add anything about their thoughts? How, like, I don't know, like what kind of resources should the course include, like videos or exercises, or how do you think the course should be promoted? So any questions like that, Brian and Naomi and Pei-Kyung, are there any other questions you would like to know from the attendees?
So when we have previous workshops, we discussed that we will have the modules as a standalone, so that if you're interested in the ethics part, you can take the ethics part. And if you want to look at costing, you go directly to the costing. We thought that it is not necessary for people to sit through Module 1 to Module 9, but in case, let's say people want to, if you land on the advanced one, we will give you a hint to say, if you haven't taken the basic one, you might want to take the basic one. But we'll make, the intention is to make every module a standalone. I wonder what you guys think about it. But yeah, we got a good comment here. I think video exercises are great. Yeah.
Then there's at the end of it, have in-person training, where we can do face-to-face trainings. Yeah.
And each module, I think, correct me if I'm wrong, is between 40 minutes to an hour max, right? So that's the plan anyway. Yeah, with some quizzes embedded within each module.
Great. So I think we've had quite a productive activity 1 and 2 now. Brian and Dan, do you have additional remarks?
No, I think this has been really helpful, and thank you to everybody who made additional comments as well. If you can think of anything, you can either still post it in the chat, or of course you can contact Brian and send your comments after the session if you reflect on it and then you think of something else after the workshop.
Great. Well, thank you both, and thank you everyone for your participation. So I'm now going to hand over to Omen John for the closing session. I think it's been quite a productive afternoon and we've had a lot of feedback. Over to you, Omen.
Omen, are you there?
Yeah, I'm here.
Okay, excellent.
Hi, everyone. Hope the session was good and we were able to go through what are the needs of each of us who are aspiring or wanting to be good practitioners of data sharing from our own research projects. And I think we have had a lot of opportunity to discuss what are some good practices, what are the courses that are around. I think we can take a few questions. Is that right, PK? Generally, of what are your expectations from this body of work, and maybe answer those ones specifically, and then discuss with you what are the next steps and how we plan to go forward on this. So you can just raise your hand or just open your mic and ask your questions. We have all the experts as well as the discussants here. And all of us are experts because we're working in this area and aspiring to share data. So experts by experience.
So the one thing to say is that Uman, Naomi, Brian, and myself were in the data sharing working group of the Clinical Research Coalition. So you can also ask us directly questions if you're struggling with any issues on data sharing or data management.
Looks like everybody is very clear about data sharing. So we should be seeing all those repositories being filled with data from all of our research teams who are participating here.
Oh, Joseph, good to see you. Did you have a comment?
No, thank you. Thank you very much.
Where are you dialing from?
So I'm from Kumasi in Ghana.
Okay, excellent. It's nice to have you join.
You see, I'm on my phone, so I seem to appear twice.
Okay. Perhaps Anne can do the feedback form while we are taking questions.
Yeah, Sumaya has got a question. Sumaya, go ahead.
Thank you, sir. Actually, the question stems from something that practically happened when we are trying to share data and work collaboratively with various stakeholders in the healthcare system. What we do come across is that the same guidelines may not have trickled down, the healthcare system, and to have people on board and to get them to work along the same guidelines and follow the same rules to share data can be a challenge. Do you have anything in mind how you can get, the message across the entire system and have people on board so that we can work in a more smooth, function manner?
So I'll take this question first, and then I'll let EY and others respond to it. So I think we need to segregate between data within a research context, which is governed by the good clinical practices and also the basic understanding that we get into with each of the research sites. So if we are all collaborating on a joint research project, it is expected that data is shared between all the partners. And so that is one context. Whereas when you come to healthcare systems in terms of health services delivery or specialized area, in the absence of mechanisms that govern data sharing, it would be difficult for them to be expecting to share their data. So if for example, we anticipate that even in the a non-research setting where data is to be shared, it would be good upfront to have these principles of data sharing being discussed upfront, what the expectations are, so that everybody is on the same page. So most often when we are doing research, there would be clinical trial agreements and data sharing agreements that are in place. So those ones, it's easier to handle and make sure that everybody concerned who are decision makers with regard to the data sharing are trained and aware of the expectations, the SOPs on that. Over. And Piva, you want to take it on?
Sorry,
you're on mute. Yeah.
Well, maybe others. Yeah, I think maybe Naomi or Brian might have more things to say.
No, I think having the expectations clear right from the onset, especially in a collaboration, is very important. And in some countries, I'm aware also that you need to do data sharing agreements right from the start, because every partner has to make that commitment. Otherwise, the objectives of the study cannot be met. It's a bit different where you are requesting for data from people who necessarily don't have a commitment to provide it. And I guess here there is a gap. There needs to be more sensitization about the benefits of data sharing, acknowledging that there are some potential harms, but how we can harness the benefits more for public good.
And just to say that when you write your protocol, you also should put in some wording that the data collector will be shared. Of course, you already have it in the information sheet, but the protocol should also state that, because all the investigators sign up to that shared protocol. Over. I think there's a question from Dr. Ebazi.
Yeah, let me just ask a question. I mean, I do know that data citation is a research output, and I think, you know, investigators should be very aware that sharing data and citing the data is one of the outputs that they want to have. I do not recall, but I think it was in the model somewhere, but I said to be corrected if that is captured somewhere. But my question is, how do we make our data, you know, known to other researchers? What methods or what platforms do we have to ensure that others who might be interested in using my data, you know, they are aware that this data is available in my own repository or in other repositories? What mechanism, you know, is available to make this known? Is it part of the course as well, Bodu? Or if not, maybe can you suggest to us how that can be made possible? Thank you.
So I can take that. So it's not part of the course yet. I think that's a great suggestion to add on. But increasing findability of your data is actually something that's coming to the forefront now, because it's not enough to just share it. Others, especially the ones who could potentially use it, need to know that it exists. One method that has been proposed is including the datasets DOI, so a digital object identifier, along with your publication, which means anyone accessing your publication and citing your publication will be aware that the data exists, and by clicking on the DOI can possibly already download the data or request access to it from the relevant committees. Then the other thing is, I know repositories are working hard towards publishing the data sets they have more widely, and part of it is exposing their listings to Google search and other searches from other repositories. So if you run a search, for instance, in PMC, that you can see something held elsewhere. It's all dependent on having a DOI. So if your data has a DOI, the higher chances, if not now, in the future, it's going to be very visible to others. And also, in addition to DOI, something to add is metadata as well. Having metadata that accurately describes your data. So for instance, you did a study in breast cancer, and this was done among the older population. You want to include all the tags that anyone looking for older population, looking for breast cancer, looking for cancer can find it. So it makes it more visible to people.
And then just to add on a small comment on that, is also the requirement by the journals to indicate where where you have posted your data, which can help other researchers locate your data. Sorry, Piwa, you are mute.
I'm muted, but I'm trying to tell Joseph he's muted, but actually I was also muted. Okay, I think we should take the next question. Oh, that's Joseph. Did you want to say anything else? You're muted.
No, I don't want to say anything.
Okay. Nothing from me, Brian.
Thank you. Over to you, Anne. No, sorry, Omen.
Yeah, I don't think we have any other questions. Are there any more hands? I don't see any more hands.
No. So just to say that the last session, so we will likely have all 9 modules, but this ranking exercise actually helps us to gauge how in-depth a module should be and how many quiz questions should we include, how much to prioritize, because it's going to come out in stages. Not all 9 modules will be available at the same time, so we'll prioritize the important modules first. So it's very, very useful. Yeah. Uman, do you think we should close if there are no more questions?
Yeah, I think so. So thank you everyone for taking your time off. It was almost the whole of the afternoon for us in India and the evening for people from Bangkok and part of the morning from people from UK and from the other parts. I don't know where all we are from. I think we do have quite a few from the Afro region. So thank you everyone for taking time. We really look forward to engaging with you going forward and perhaps come back to you when the modules are being prepared for feedback and all of that. And like I had mentioned in the chat, we do have a couple of projects in the area of data sharing that's on a fast track mode, and we need to work with all hands on the deck. So if anybody is really keenly interested in this area, please do reach out to us. We'll be happy to work with you, collaborate with you, and make sure that we are all able to contribute to improving data sharing in the context of COVID and beyond. So thank you all. Thank you to each and every one of the facilitators and the special speakers and the entire organizing team who have worked a lot of planning has gone into this, and thank you, Brian, Naomi, PY, Anne, and Anand, and they have both left, so we will send them thanks on email. So thank you, everyone. I think we can come to the close.
For co-organizing this workshop with us. Right, so see every one of you again soon, I hope. We will be in touch for with the recording, and please don't forget the feedback forms. And any last words? Is any other housekeeping things that we need to do?
No, thank you. If you have already filled the form, thank you. I think, Brian, maybe you can send it around to everyone after the workshop as well, in case you don't have time now to complete it. That would be useful. And otherwise, thank you. Have a good rest of the day.
Yes, it's really nice. We got a lot of feedback. Thank you, everyone.
Thank you.
Thank you. Bye-bye.
Bye.
Bye.
All right, thank you all. Bye-bye.